Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us. Well, welcome to Focus Today. I'm your host, Perry Atkinson. Great to have with us in the studio again today, Dr. Joel Klein. He's a physician with Ventana Wellness. And by the way, we're going to be taking your phone calls, and you're welcome to join us. He'll be with us for a couple of segments. And the phone number is area code 541-776-5368. Or if you're outside the immediate area, we'd love to hear from you as well. It's toll free, 800-373-5368. Dr. Klein, good to see you, man.
Good morning. Always happy to be here.
Well, delight. A term, functional medicine.
Functional medicine.
I would rather have functional than dysfunctional.
That is the point.
Really?
That is the entire point,
What is functional medicine?
So functional medicine is a more modern scientific version of a very ancient concept. And it really is dealing with the root causes of these things, they're not actual things, that we have been calling diseases, that turn out are not real things in and of themselves, they are descriptions of patterns. And what we're finding, and this is how, in a more scientific sense, diet, lifestyle and stress, and environmental toxins are affecting our health. And what's being learned now is literally how it is affecting the expression of our genes.
Really?
So all this stuff, when they started the Genome Project in 1990, they thought they were going to discover the genetic sources of all these different diseases, and then we could design treatments for these genetic sources. And they've been sorely disappointed because what they found is that, in fact, what's really interesting, you know, we have like 46 chromosomes. You know, a potato has 48. So a lot of this genetic issues, it turns out that, and then what humans do have is the largest portion of our DNA that doesn't code for a specific protein. In the beginning, they called it junk DNA. Only a scientist with hubris could call something, well, it's junk, like God made a mistake and didn't know what he was doing when he put it there. Well, it turns out all this genetic material that we have more of actually has to do with the way our genes are read, turning genes on and off. Most of our genes, not the ones for eye color or your blood type or these types of things, can actually be turned on and off, and it is environmental factors, including what's in our diet and what's not in our diet. Stress patterns even. They have done work in Canada showing how stress hormones can actually affect the expression of genes, and environmental factors. Toxins, drugs, these types of things are all affecting the way our genes are being read. So this whole notion of that there's genetic diseases. There are certain diseases that are genetic. They are this very, very small minority. The majority of what people are dealing with, and even say, well, it's in my family, everybody in my family has it. Well, there's not that there's a gene for it, but what you inherit is a tendency. And whether the tendency gets expressed depends on providing the right environmental factors. And that's where we have complete control.
This is huge. So where is this going?
Well, right now it's getting us back to basics. There are practitioners who are doing a more advanced version where there's a lot of different testing that can be done for a lot of these things now. None of it is covered by insurance. It gets pretty expensive, into the hundreds of dollars and sometimes thousands. Having had a practice where most people couldn't afford to do those tests, although I learned about them from all these great people. They all practiced in Boulder, Colorado, where they had all these people with money who would spend thousands of dollars on these tests. My patients go, if it's not covered on my insurance, I can't afford a whole lot. So I had to learn, well, how do we apply the basics? And it really comes down to the same things we've been talking about. We're just learning more in a scientific sense how that's actually working. And ultimately, we may be able to get to a point where, as Dr. Roger Williams said in 1949, he published a paper where even before we knew the structure of DNA, where he showed how genetically different healthy people could be based on their on different enzymes. That would, the same enzyme in a healthy person could vary in activity as much as 200 times. Now we know how that works based on the DNA and the genetics, but at the time, they didn't know exactly how it worked. But what they knew is that if you have a more sluggish form of the enzyme, if you give it more of what it needs, like the vitamins, this is where the vitamin therapy came from, the enzyme will increase its activity. So what he said in 1949 is that if we could map out people's genetic and nutritional requirements, we could custom design programs for them. How far has that gotten?
Well,
it's gone slowly by people outside of the mainstream, because right when he published this, medicine was becoming quite enamored with its successes with antibiotics. And this was the whole revolution. The one drug, one cause, these acute infections. How we got, oh wow, we found the bug for this, the bug for that. We can treat it with this antibiotic, that antibiotic. And that seemed to be the keys to the kingdom. And it turns out that that is more the exception, that when we're dealing with these chronic diseases, it is not one cause that you treat with one drug, but that got drowned out. So what we're looking at are individualized, custom designed programs to a certain extent. And I use a lot of the person's history and exposures and things to put together, okay, what has happened in your body? And what do we need to do to help set it right? What are the dysfunctional patterns, that are causing altered expression of your genes into this disease pattern? How do we work with those? And a lot of it's our same diet, stress, and environmental toxins.
Well, you hit on some big ones here. Let me fast forward. I know this is controversial, so I don't want to get too deep here. But on the other hand, you're suggesting that, as you know, on the ballot, there's a big GMO thing here. What's your feeling on that?
Well, the problem is, and you can argue both sides, is that we do not know enough about them.
Right.
And we can say things are safe, but how do you say something's safe if you haven't studied it for generations?
Right.
Here's one of the great studies in epigenetics, which is how our genes are actually read. So one of the pioneering researchers was a guy named Randy Girdle in Atlanta, who took this strain of mouse called the agouti mouse that was metabolically obese, diabetic, and light brown. Genetically, okay?
Okay.
He took those mice. Now in this case, again, took pregnant mice and fed them extra B12, folate, and B6, because those are the nutrients needed for a lot of this gene turning on and off cycle.
Oh.
Their offspring were non-obese, non-diabetic, and had more mottled skin rather than the brown skin.
Wow.
Not only that, but with no nutritional input, their offspring were non-obese, non-diabetic, and had mottled skin. And the effect lasted for 3 generations before it wore off without extra nutritional input. So the bottom line is, we don't know. We don't know what's going to happen here, and I think there are, the arguments about, since it's a patented product, of contamination. I realize there's an economic problem with it, all that, but I've gotten jaded over the years, and unfortunately, modern science has become way too political. So I don't trust it, quite frankly, when you say that, the scientific studies say it's safe. Well, who paid for the studies? How are they done? I've become a skeptic in a number of those
I don't blame
things.
you. And I don't want to get off on this. We can get onto it another day. But something is wrong out there, because we won't call cancer epidemic, and yet it is epidemic.
It's the number 2 cause of death in the country, and it may be the number 1. Coming soon. Now, I'm not so sure it's, again, my problem with the GMOs is that I will bet, now this is a gut feeling, that what we make is not as good as what the creator made. And they're going to be genetic, and the food will be inferior. I'm not so sure it's going to cause mutations or what it's going to do. And all that. It could, but my feeling is it won't have the same nutritional value.
But if you go back to functional medication you just talked about with the chromosomes, and we're messing with that.
Exactly.
What are we doing?
Well, we're messing with the plant chromosomes, and they can claim, well, the plant is not going to do with the human. And I don't know. I don't know that part of it. What I want to say is,
that's to say the origin of all of that was you could mix and match it.
And we're working with plants. What are that? I don't know that that's going to affect our genetics, but as I just said, it could certainly affect the expression genetics.
Right. Let me take some phone calls here. This is we got to come back and do a whole show.
Oh, we'll do more, because this is all of it, Perry. Everything we talk about can really be under this rubric.
It really could. All right. Hi, Jean. Thanks for waiting. What's your question for Dr. Klein today?
Okay. I've been suffering for the last year. When I was in Spain last year on vacation, I slipped when I was getting out of the bathtub, and I landed on my butt. I slipped several times trying to get out. The bathtub was slippery. So I landed 10, 15 times. Since then, I've had MRIs, X-rays, physical therapy, chiropractor. The last thing I did this week was I went to a pain specialist. He's suggesting a perineural injection therapy, which is dextrose injections.
Right.
And I've got to have a series of them. They're not covered by insurance, so it could cost me about 6 visits, could cost me close to $1,000.
Right.
What do I do?
Well, it would be impossible for me to give you a medical opinion based on a phone call.
Have you heard of that?
Yes, I have. I've seen people doing all kinds of interesting things with that, and using dextrose solutions, using dextrose for prolotherapy, doing these perineural injections where they actually, if this is what it's called hydrodissection, that's being used very effectively for carpal tunnel syndrome, and things where they actually by ultrasound, get the needle right in between the nerve sheath and the nerve to try to expand the nerve sheath to take the pressure off the nerve. So yes, and you have to, look at your practitioner and see what they're doing. But this is a traumatic thing. This isn't really the kind of functional thing. Although you may have things going on in your body, like a tendency towards inflammation caused by diet, caused by stress, and all that may have made these types of traumas more injury producing. Those would be the things that I would deal with. I don't deal with the mechanical problems that are actually causing pain, but these factors that we're talking about can make all these chronic pain and inflammation syndromes worse.
Yeah, because they're saying the risks are like there could be nerve damage or even paralysis.
Well, everything is going to be a risk, and so is living with the pain for the rest of your life. So you have to weigh the pros and cons and do what you think is best.
So diet could be causing some kind of inflammation.
That's correct. If you have a diet with a lot of processed flour products, a lot of sugar, not a lot of produce, then you're going to be promoting inflammation in your body. That trauma could have set off an inflammation pattern, and those are the things that I work with.
Okay.
Right. All right. Thank you.
Thank you, Gene. All right. Interesting. 7765368. All right. Coming back a little bit to functional. Oh, let me take a break.
Okay. Yep. We've already talked too long.
We're talking about functional medicine with Dr. Joel Klein. It's just a loaded topic here, so we'll be right back. Okay, we're back with Dr. Joel Klein, and he's with Ventana Wellness. And listen, if you are looking for a good physician, here's one. And we're talking about something today, and I love his approach to this. It's called functional medicine. And it's going to take about 329 shows to discuss all of this. But
I'll try to boil it down.
But it is just amazing that you're trying to figure out in this functional medicine what a person is suffering with and how you line that up with not only lifestyle but obviously diet, because we're putting too many supplements in there. I mean, I say supplements. I mean artificial foods and things like that.
Right. Yeah. And we're just not getting. We're getting things, too much of what we don't need or shouldn't have, and not enough of what we need. I mean, it's both omission and commission. Right. So we're eating way too many, obviously, as we always say, of the processed foods, of things that high sugar, that promote inflammation, and as a result, because of the way that commercial farming is, they've looked at this, and the organic produce does have more nutrients in it. Stressed plants, this is Botany 101. A stressed plant will make more of all those compounds that we actually find beneficial. Those are defense molecules for the plant. So you don't want to stress it to the point where it doesn't grow. But when it's stressed with insects and temperature extremes and even a little bit of drought and all that, it makes more protective chemicals, and those are the ones we need. When you take all the stress out of the plant, it can make use all of its energy to just make starch. So you can wind up with a huge You know, zucchini may be this big, but it doesn't have the nutritional content.
What about
that it used to
hybrid?
have.
Then hybrid plants.
Don't know enough about it, but I know that little bit about plants. That to me is one of the main arguments for organic produce, in addition to the the toxin pesticide issue.
So where is this in your thinking as a physician in treating people and using medication?
So I have a saying that I use in the practice, and I tell people, if you're drowning, I don't have time for swimming lessons. So the medications I use, and I've had a lot of experience. I've had 32 years in regular medicine. I've now done this kind of holistic medicine for 14. So I have a good picture of when we need to use medication, when maybe we can try some other things. Because sometimes people have dug themselves a pretty deep hole over the decades, and we need to use medications, but as a tool, not as an answer just to manage symptoms, but as a tool to accomplish a specific goal. And then we can continue to work on these functional issues over time and see if we can possibly make the medicine obsolete.
All right, let me take one other call here, because I have one other thought about that. Steve?
Perry.
Hey, what's up, man?
Hey, I wanted to give you a little testimony about nutrition. You know me, I'm not overweight, very active, but I have not slept a night in my bed for over 10 to 15 years, literally. I'm up every night, got my sweats on, go to the couch. And I finally just got sick of it. I have to do something. I went to a nutritionist. She says, I think you've got inflammation problems. So I went on this diet. Today is 11 weeks.
Right, and you're sleeping.
No grains, no sugar.
Yep.
It took me about 3 weeks, my stiff hips and knees, where you could get up and down and walk without feeling like a cripple for 3 steps. Took about 3 weeks. 6 weeks into this, I'm sleeping in my bed every night.
Right.
I mean, it is like a miracle.
Right.
Have more energy. I'm not going. I've lost 13 pounds, and you know what I look like, Perry. I don't have 13 pounds. I got a little fat around my belly, but very little. It ain't there now.
Yeah,
right.
I'm not cutting down on my volume of eating either.
No, don't need to. It's all the inflammation. This is what I do every single day. Now, not everybody needs to do no grains. I'll usually start with gluten, since that's the most common culprit. But there are people, particularly people with autoimmune issues, that really need to go off all the grains altogether. And this is where the whole disease model falls apart. Because I'll have people with, you name it, asthma, eczema, migraines, arthritis, autoimmune, whether you call it lupus, whether it's rheumatoid arthritis, or whether the lady who came to me saying they're calling it intermittent undifferentiated spondyloarthropathy. It doesn't matter. Those names are a categorization system, a way to categorize things, but all of those people will commonly get better a lot of times with the same basic program. And a lot of it, the food allergy causing inflammation, is a huge, huge issue for many, many people.
Well, boy,
I noticed you on Sunday, Steve. I didn't come up and say anything, but you were noticeably thinner.
It was literally inflaming your brain, and that's why you couldn't sleep. Right.
Yeah, well, what had happened is I would have so much pain in my hips, the soft tissue, not the joints, but it would wake me up 4 hours. I mean, I would hurt so bad, I had to get up. I could not stand it.
Right.
And where I lay on my hips, I can't lay on my back because I have a bad back, but boy, I mean,
good stuff.
That's a lot of years to not sleep to get her changed in 6 weeks.
Wow.
Yeah, this is what I tell people is well, I don't promise the miracles because I'm not the one who doles them out, but they show up not infrequently. And actually, Dr. Jeff Bland, who's considered like the godfather of functional medicine, and I heard him at a talk one time say, "I'd like to think we're in the business of miracle maximization."
Yeah, right. Exactly.
Thanks, Steve.
Okay, Barry.
See
Bye.
ya. Bye. All right. Let me ask you somewhat of a personal question.
Sure.
When did you convert from over to more of a holistic?
Well,
what happened to you?
Well, that's an interesting story. I knew better for a long time and kind of sold out because my life was spent being a good little boy doing what I thought I was supposed to do. So my brother and sister-in-law were ex-hippie transcendental meditation teachers, so I got exposed to a lot of this stuff. But it wasn't until I really I completely crashed out of regular medicine in 1999. Actually took a year where I didn't do anything. I really had to figure out what I wanted to do. Started to do some research into some of these things that I had heard about, read some books and went, this is where all this is. And then just started listening to people. And I would listen to people who seemed like they knew what they were talking about, who weren't flighty, who didn't have some agenda that I could tell, but really seemed like they knew what they were doing. And then I find out who they were listening to. And traced it back that way over the years. This is early, like in the early 2000 period.
Since the last time I saw you, you've lost weight. What are you doing?
Oh, well,
besides riding your bike.
I did something that, again, is not that people don't like, but I actually did an HCG, 3 weeks of an HCG weight loss program. So, and I lost 20 pounds.
And it worked.
Oh yeah, and now that if I stay off the carbs and I don't snack at night, because I do stress eating too, folks. It's not just you, and so I can keep it off and get back into my pants.
One of my very concerned issues is cancer, but the other one is diabetes, and they both seem to be epidemic. And it appears to me with this functional medicine explosion that this stuff is very treatable. Because
the same issues are at the root of both, commonly. Okay. All of these chronic diseases have similar roots. The diabetes issue is the same. Certainly, it's not only the diet. What they're finding is that people who have disrupted ecology in their gut from antibiotics, killing off good bacteria and overgrowth of bad bacteria, have a much higher rate of obesity and diabetes. So again, this is the environmental toxin if we're talking about antibiotics. The cancer issue is going to be both environmental toxins. Inflammation is at the root of a lot of chronic cancers. So again, most of these things have the same common root, and that's the point. We do need to know the diseases if we're going to talk about medical treatment, how we address them. But if we're talking about the roots are basically the same, and then each person is going to express those imbalances differently because they have unique genetics, and those genetics have been even further influenced by the unique circumstances of their life.
Where do you put red meat in this?
Red meat is not bad. The whole saturated fat thing has been overblown, probably because if we eat meat that's been stuffed with grains, like corn, it's missing the healthy fat. This is Dr. Lauren Cordain's work at Colorado State, where he actually analyzed these animals, and they're missing these healthy omega-6s and omega-3s that we are supposed to get in our diet. And it is probably the absence of those fats in grass-fed meat. To do a gross overlook, people who eat meat and drink more milk get more cancer. These are, again, a statistical association studies. And again, what meat are they eating? What milk are they drinking? And that there are other factors. So I don't think that red meat by itself is not, I do not believe they've shown as carcinogenic. They've shown this statistical association, but there are other more plausible explanations.
So what do you think is the best form of protein?
Good. It depends on the person, and it depends on the person's lifestyle and their constitution. This is why there's no one diet that works. There are some people who can get away with a vegan diet. There are not many. If they have done the spiritual work where they are living in bliss and surrender, or they are a Buddhist monk who is meditating 16 to 20 hours a day with a finely tuned nervous system, I think they can do a vegan diet. But I have a lot of people who are living warrior lifestyles in our society. The warriors didn't eat that diet. They would have all been killed off. They're living warrior lifestyles, eating a vegan diet. I would say clean protein as best you can. Ideal would be grass-fed, hormone-free, antibiotic-free beef. Chickens that aren't filled with stress hormones, these types of things. I know that there's an affordability issue, so people have to do the best they can.
Okay. Dr. Joel Klein with Ventana Wellness, and you may want to go to ventanawellness.com and check it out. And they have a lot of services there, and he is the physician, the head physician there. And if you're looking for one, he's the guy. And if you want to learn more about functional medicine and how it may work for you, you may want to make an appointment. Let's continue on with this. Because the question I would have next, we'll have to answer it next time, is there limitations to functional medicine?
Of course.
Okay, we'll answer that next time.
Okay.
Thanks, buddy. Good to see you.
Thanks,
okay,
Barry.
We'll be right back.
We can do that.